Hi, I'm Dr. Philip Chang. Today we're doing another video on fat transfer. This young lady is 78 and she tells me she has a birthday next week to make her 79. And this is her birthday present to herself. So our goal today is to give her more facial volume. And also after this procedure, we're going to do a laser procedure to reduce some of these lines. Here's an example of fat. We're doing this in place of doing any forms of facial fillers. So we're not using Juvederm or Restylane or any of those types of materials. We actually took this fat from earlier from her belly. And the benefit of that is she has unlimited supply, and you can see that we can put as much as we want into her face. Our goal today is putting something like 40 cc's or 40 syringes of filler into her face. When someone comes into the office for something like Juvederm, they're often asking for 1 syringe, 2 syringe, and you'll be amazed how much we can actually get in. And so right now what we're do is start, and I'll try to talk and do this at the same time. So she's already numbed up and hopefully she's completely numb. And so the goals today are to fill in her cheek area to give her a better cheekbone, to fill in some of this temple area, and then to fill in somewhere around the mouth. So we'll just start now. And again, we're trying to put some around here just to give her a better definition around her eyes. And this is a very common area where we'll usually put in, again, some forms of facial filler. But since we're going to use the fat, we, again, we have the basically unlimited supply. So we'll get right onto the rim, and this is how we're going to camouflage this line. In addition to doing the laser, which will help smooth it out, that will be really good procedure for her. You can see she already has really kind of good cheekbones, so we don't really need to put too much into the actual cheekbone area. And the goal here really is not to improve that cheekbone, but to improve the appearance of her eyes without doing an eyelid surgery. Music's a little loud, but that's fine. Okay, so so you can see that's 3 cc's right there. Okay, so we've already put in 3 cc's, and as a reminder, each syringe of Restylane or Juvederm is approximately 1 cc, and you can see it really doesn't do all that much. And yet, if you look at the appearance of this eye versus that eye, you can see actually a pretty good benefit already. And that's what, not everyone's going to do fat, but that's the benefit that you're going to see with fat, is that we have this unlimited supply, and that's the goal of using when we do Restylane too, is to improve this area. I'll often try to put a bunch there. Okay, so gives her a better cheek so far. Okay, so you can see this candy is actually curved. We can go around her temple here, and we're trying to do it all through these little 4 incisions. And you can see just by doing the fat, some of these lines that she doesn't like are actually improving. But you can also see that it's never going to improve all of them, and so that's the benefit of well, that's why we're going to be using the laser. Goals for her, even though she's 78, are not much different than the goals for someone that's much younger. The goals is to give yourself more facial volume, because you start losing that as we get older, and that allows the skin to play a little bit too much, and so that's when you start getting these lines. And so we're going to try to plump up her skin. And one of the things that we've now discovered is that fat actually has stem cells. So this fat that's actually going in is actually alive. And those stem cells, when processed like we did, actually makes new cells that are not theoretically old. They're actually theoretically youngish and can grow. Okay, so far we put in about 9 cc's, and we're going to make her overly plump because a lot of this is fluid, a lot of it is going to go away. For the purpose of this video, we're going to start doing her lips now. Usually I don't do the lips until last, but we're going to try to reduce some of these lines. And again, the goal is not to get rid of all of these lines. The goal is really just to plump things up a little bit. I have no intention of putting a lot inside the lip itself. What we're trying to do is, you can see her lip is actually thin, but it's thin because this is long and not plump. So she doesn't have a lot of lip definition. And this is also true of youngish people. When you put it a lot into a lip, I think it looks overdone. So what we're going to do is actually put in some along the line and actually a lot up here, and this will rotate the lip, and you can see she actually has pink lip. It's just that it's rolled in. So the holes that I made for this cannula are in this crease, which she should barely be able to see after this procedure. And I try to do everything through basically 6 of them. There's one here, there, and there's actually one here in the temple, so we can build up her temple a little bit. I know for a fact this is going to make her lips look huge. This is going to make her lips look huge for about 2 weeks. And so hopefully you can see that they won't actually stay that way. They will get better. The face is generally about 1 week. So I'm just doing this a little bit slowly. We're in no rush. Okay. So you can see this is going into the lip a little bit, but the vast majority is actually above the lip. Doing okay?
Mm-hmm.
Okay. And I completely realize it makes her lips huge, but it won't stay that way, okay? And she knows this, and I've told her this before the procedure. But you can see one thing, look at this outline. So, and that's without putting much in her lip itself, okay? What happens, again, this curls under. Once you get the volume back, it curls back up, and now you get that Cupid's bow again. So, okay, we're going to put a little bit more in her lower lip now. I realize I have to put a little bit more there, but I have to do that from the other side. Okay, so same idea here. She has a lot of vertical lines. We're going to do some of this with fat, and we're going to do some of this with the laser. Okay, so, and again, I try to do this with as few incisions as possible. Can you raise your chin a little bit? Can you raise your chin a little bit?
Mm-hmm.
Okay. So this fat will actually improve the quality of her skin, theoretically, through those through the stem cells. And this fat is living, so it will stay in place, hopefully, for at least another 5-10 years.
However